And greetings, class. We will be looking at chapter 6 on bones right now. Normally, it's not even covered in physiological texts. Of course, it's very well covered in anatomical ones, but not physiological. So I think it deserves its own chapter and its own lecture, although it's a short one. So just know that there's not as much physiology with bones as there would be anatomy, of course. So let's get started here. Hopefully, nope, that's the wrong one. Let me pull it up. Stop sharing. Share. You should be seeing it now. Yes, we will go big. Okay, so what is, you know, with bone tissue and the skeletal system? So again, it's a relatively short one, and let's get started. Children looking at bones, of course, one of the reasons you can have um, fossils of bones is because they are of course, a very hard material, but they can actually absorb the minerals that were in the, let's just say, the water slash soil, whatever, and then get it will calcified, but also become mineralized. So interestingly, the bones actually go from cartilage to then bone material. And then again, in the fossils, they actually become mineralized. So it's kind of an interesting process. But anyway, let's keep going. Um, what do the bones do? More than you think, actually, but they, of course, support us and allow us to move. That part would be easy to figure out. They protect us. They protect the organs and, of course, the head and the heart and lungs, big time. They will actually produce red blood cells. And that's part that you probably don't know so much. And we can store fat in them. So bones have fat and blood. People don't think about that so much, but they actually do. So there's a yellow bone marrow for fat and a red bone marrow for blood. Not a lot of bones have the red bone marrow, though. So it's usually what we call your axial skeleton in adults. Kids have them in a bit more locations. And then it's only in the ends of the bones, of the axial bones. But again, red bone marrow is responsible for hematopoiesis. Go ahead and know that word. And that's red blood cell formation. Okay. And they were just showing a brace. I've had not quite this kind of knee brace. I've had various braces. And again, that's to protect your body while your bones are getting repaired. But anyway, that's all right. Types of bones. I'll go ahead and want you to know these types of bones and perhaps an example of each. Okay, so that's it. So irregular bones are very simple. They're the pelvic girdle and the vertebrae. Okay. Flat bones are in a couple different locations. Sternum is definitely one of them. Ribs would kind of be considered one, and cranial bones would actually be considered flat bones. Long bones are your typical bones. So those are in your appendicular skeleton. And short bones are mostly your tarsals and carpals, so your hands and feet bones. And there's an odd one called a sesamoid bone in the knee. So the patella is a sesamoid bone. And yep, we'll keep going from here. Okay, there's different parts. Well, this is sort of anatomy, but it's important from a physiological standpoint. So let's just start at the top here. Articular cartilage is on the top, and this is allowing for movement where two bones are meeting each other. So that's at a joint. And we have, of course, a synovial joint very often will have these, but articular cartilage is so the bone doesn't get worn down. When this starts wearing down, and then even the bone starts wearing down, that's known as osteoarthritis, known as a wear and tear. I actually have mild cases of it in my shoulder and knee. So it's kind of the old age syndrome here. And that's why old people are always walking, differently or tenderly because they're probably in pain because their bones have worn down. Um, there's this whole area is called the epiphysis between this long shaft, the diaphysis, and the epiphysis is known as the metaphysis. So go ahead and know that region. In this region, you'll find the epiphyseal line, even though it's part of the epiphysis. If it's closed, okay, so it'll be an epiphyseal line, that's you've stopped growing. It's an epiphyseal plate, you're continuing to grow here. And okay, so coming down into the diaphysis, we have a big medullary cavity. Sometimes it's called canal, but cavity. Inside that is a lot of blood flow. The yellow bone marrow is in there. Oh, and by the way, the red bone marrow would be in this region here. So the epiphysis here. There's nerves as well in there. So if you break a bone, does it hurt? A lot. Okay, it's because there's nerves in there too. So people don't think of bones as that living material, but yeah, it's got blood flow, it's got nerves, it's got all that good stuff. This is going to be compact bone on the outside. This bone in this region here is known as spongy bone or trabecular bone. So those are the two main kinds of bones we have. But again, on the outsides of bone will always be compact. There's actually a periosteum on the very outside of the bone. That's not technically even bone material, but it's a covering of our bones here. And every so often you'll find holes in that for the blood flow in there, and those are known as nutrient foramen. And there's, again, a nutrient artery is going to go through them. And then, of course, here's showing the distal end also with articular cartilage. So what bone would this be, everyone? Yes, a femur. So that would be where the hip bone connects in. That's, of course, where the knee is located. So again, get those different regions. Where is growth of long bones occurring? That's on the epiphyseal plate. It's actually on this side. So it's on the lower side of the epiphyseal plate. What is contained in the medullary cavity? We talked about those three things. And what you feel, would you feel? We should have said, would you feel a broken bone? And the hell yes. And again, because nerve, blood flow, and oh, and by the way, we also store calcium and phosphate in our bones. So it's a stored site for those minerals. Okay, periosteum and endosteum. Periosteum, again, is that outer layer. Again, it's not technically bone, it's a fibrous layer, right? And the periosteum has a cellular layer as well. But then you have your bone. So the outer part of the bone here. And again, there's osteocytes in the lacuna. And we talked about that before with a chondrocyte. Now we're talking about it with an osteocyte. And we'll get into what that's the final form of a certain bone cell. So it's called a mature bone cell. These are known as lamella, and this entire thing would be an osteum. And we're not going to get into the anatomy of all this too, but and they're showing an osteogenic cell and osteoblast. But let's keep moving on. But again, this would be part of compact bone. So they're just showing the outer regions of this. This is compact bone. Okay, this would be a flat bone. Again, I showed you that the skull had them as well. It's literally a spongy bone sandwich, you could call it. So there's compact bone, spongy bone, and then compact bone. Why do we even have spongy bone? It makes it lightweight. Okay, so you get volume with a lightweight. So if you actually felt a real bone, and you'll see them in anatomy sometimes, they have a slightly different ting to them and a different texture to them. They are really lightweight when they don't have the water and the fats and all the things that bone normally has in it. And also osteoporosis is where this would be weakened quite a bit, and then so it could fracture because of the osteoporosis. Yep, so we'll keep going from here. Now, what are some other bone features? We've named these. I'm not going to hold you responsible for them in our class here, but as you've already had anatomy, so you know there's landmarks on all these bones that can be identified. Very often the landmarks are for muscle attachments or nerves to go through something rather. So, and of course there's sinuses in the skull and all that. All right, let's keep going. Okay, this is very important. You need to know this progression. The stem cell of a bone cell, so it's already been differentiated, but it's known as an osteoprogenitor cell. Okay, so this will become an osteoblast. Now, blasts build bone, blasts build bone, BBB, and they will actually lower blood calcium as well because they're putting calcium from the bloodstream into the bone. But this is when you're growing and repairing, the osteoblasts are at work. The osteocyte is the mature bone cell, so that they are maintaining the bone, they're vitrifying it, all that. But this is the progression of the same type cell going from one stage to the next. Osteoclast is a totally different type of cell, and it's actually a modified macrophage. So it actually eats bone and then recycles those materials to where it's needed. And the thing that's most recycling is calcium. So PTH, or parathyroid hormone, will stimulate an osteoclast to then what we call resorb bone, or pull it back out of the bone. And then this is very important for bone remodeling as well, though. So maybe we'll get into that in a little bit. So again, those three, and then the osteoclasts. You could think class cut bone, but it's not really cutting bone, but it is reabsorbing it. Okay, and the diagram of this, again, the various parts here, this would be known as an osteon. There's three kinds of lamella. Go ahead and know these. The kind that surround a given central canal, which is where blood flow and nerves can be, you think, those are concentric lamella. There's stuff in between the various things known as interstitial lamella. And then there's some on the very outer regions of the bone, the circumference of the bone, basically. And it's known as the circumferential lamella. And again, then you have your periosteum on the various outsides. So the very outer layer here, and then you go further in, and then you may even have spongy bone, depending on the location, further in. And again, it's known as trabeculae. That's why they also call it trabecular bone. But the central canal is now there's even connecting canals there. So this is sometimes called the Volkmann's canal and the Havasarian canal. But don't worry about those for now. Just kind of know the three kinds of lamella, and the central canal, and the periosteum and circumferential. Okay. And again, compact bone versus trabecular. You will see the outer regions of the bones with these surface things. I'm not going to test you on anything on this particular spongy bone diagram, but they are showing right now how osteoclasts are busy at it. The caniculi are these little lines. Again, each circle is a lamella or layer, and there's a lacuna buried there with probably an osteocyte inside the lacuna. Okay. And again, here's blood and nerve supply to the bone. So we have a lot of blood throughout. And again, the medullary cavity is what's holding this. And again, it exits and enters the bone through a nutrient, actually foramen. And then that's where the nutrient artery and vein enter and exit. And you'll see them on real bones every so often. And yep, and even in this area is where you're going to get plenty of blood flow as well. Okay, there is two kinds of ossification. We're going to try to decipher them, but intramembranous ossification, okay, mesenchymal. So go ahead and associate that word, mesenchymal cells group into clusters and form what they call ossification centers. And then they become osteocytes. Okay, so trabecular matrix, periosteum formed, compact bone develops and superficial to the trabecular bone, and crowded blood vessels condense to this. Bottom line of this whole thing, and again, I don't need you to know the details, is this is almost more like what we call free-forming bone. It was derived from mesenchymal cells. Okay, and this is more for our bone. Our bone girth. And again, certain bones are made this way. Okay, so Endochondrial ossification is what we have in our long bones and many some other bones. And this is how, say, a baby would develop. It starts off as cartilage, believe it or not. And then that's we'll call it the scaffolding or the framework for what then becomes bone. So this is called endochondrial ossification. So within the bone or within literally it says within the cartilage, then it ossifies into real bone. So, and these have what they call primary and secondary ossification centers. I'm not going to make you know the locations and exactly what happens here, but bottom line is it's transitioning from cartilage to bone. Are babies' bones more rigid or more flexible than adult bones? Much more flexible. Okay, so the reason is they're made of cartilage. Okay, and they're transitioning up through about 2 years. Once an infant is about 2 years, plus or minus a little bit, then it's all bone, and now it's going to get bone growth, not cartilage and stuff. If this happens early on. So here's a slide I made just so you can see the differences of the two. So I could have a test question on which is which, but let's just take this table over here. So endochondrial, again, type of ossification coming from these centers, these primary and secondary ossification centers. And again, they're transitioning. Cartilage is formed first and the bone is laid down on it. So again, it's transitioning the cartilage into bone. Proceeds through the intermediate cartilage, important formation of long bones. Again, so those bones that are in our appendicular systems. Takes longer time to form a bone, stops at about year 2. So again, we've gone through this thing. Here, the bone's going to continue to grow through this intermembranous ossification. And again, bone is directly formed on a mesenchyme, does not form intermediate cartilage. Important for bone of flat bones. So flat bones use this. Takes less time to form a bone. Stops, it should be stops, not stops, at year 18 in females, 21 males. It's obviously not a set year, but it is earlier. So you don't see the long bone growth as much here. You do see, believe it or not, this isn't totally correct in that you can have appositional growth. So again, longitudinal growth lengthwise, appositional growth in thickness. So this an appositional perosteal formation. And again, facial bones increase in bone thickness participates in remodeling throughout life. This is more correct. Okay, so this isn't as correct. This is from pedia.com. All right. And longitudinal bone growth here, they're just showing that would be, again, in length. Once your epiphyseal plate is closed, or I should say, once it's an epiphyseal line, but while the plate's still existing, you can still have long bone growth. And that's just the way it works. Oh, and it's always being deposited on the lower side. So the bones are growing outward. And yep, so this is just showing more on that. I don't need you to know definitely, where each epiphyseal line is, but you can see them in bones when you slice them widthwise. And the different fractures, I don't need you to know either. So if you become an orthopedist, you should know them, but otherwise there's some. If you go through the skin, which one is that? Yeah, an open fracture. So yeah, you can have what they call compound open fracture. That's pretty gross. Obviously, that would be but even yeah, comminuted fractures can be pretty bad, impacted. Anyway, there's all kinds of different fractures. The green stick one, yeah, small one. But all right, let's keep going here. And this is an important. Go ahead and know these 4 stages in order. Okay, so we develop a hematoma. We develop a spongy bone callus or soft callus stage. Then a hard callus forms. Then we have remodeling, or what they call, the ossification. So again, hematoma, soft callus stage, hard callus stage, ossification. Remember, with the general tissue repair, something very similar. So go ahead and look back at that too. They'll both be potentially on this next test. Okay, That is, I believe, nope, a couple more, yeah. Um, this is the synthesis of vitamin D that happens in skin, but of course, this is important because our calcium balance is due in large part because of vitamin D. So we'll get into the details of it, but skin, then liver, then kidney are all participating in the final formation of what would they call it? 125 dihydroxycalciferol. Okay, it's a mouthful, but calcitriol is what they call it, or D3. D3 is the common one. All right, and we'll keep going here. And yeah, this is growth in males versus females. I don't think anyone, but males will have much higher peak bone mass. This is why osteoporosis doesn't hit males as much. Both decreasing, actually, even at a similar rate, but it's only because males started higher that they won't have osteoporosis as much. Again, they can have it. In fact, I think it's 1 out of 4 cases, or I should say 20%. So 1 out of 5 cases is usually male. But again, females have the big decrease at menopause. And yep, so bone density peaks right around 30, sometimes late 20s, and then goes downhill from there. So it's important to really jack up your bone mass as high as possible when you're young, and then you suffer the downhill slide. I'm trying to fight. And yeah, okay, so here's calcium homeostasis. I told you 2 minerals are in the bones, calcium and phosphorus. Calcium is being the one addressed here, and it's because it's so important in our bodies, but we need it for muscle contraction, for nerve conduction, for all kinds of things. But parathyroid hormone, go ahead and know that's what raises blood calcium, and that's the more important thing for our body. And it does it in, well, 3 different organs are participating in it. The first would be the bone itself. So osteoclasts are stimulated by parathyroid hormone to pull calcium out of the bones. The kidneys are stimulated to resorb it, to pull it back in and not pee it out, basically, not micturate or excrete it. So it's getting reabsorbed into the bloodstream. And then finally, PTH stimulates vitamin D to kick in. So it's absorbing more from the small intestine. So that's the action of vitamin D3 is to pull in calcium from the small intestine. That's why D3 and calcium in a diet are so critical together. And then if you had too high a calcium, which can happen and it can be quite dangerous too, causes release of calcitonin. So calcitonin tones the bones, as I say. So it will lower blood calcium by putting calcium into the bones and causing you to excrete more from the kidneys. So you're going to pee out more from the kidneys. And that's pretty much the way it works. So again, if you have decreased calcium, these 3 are going to work together to raise it. And if you had high, these 2 are going to cause to get lowered it. So, but again, those 2 hormones, go ahead and know them and what they do. Okay, that is it. So thank you very much. And we will end this now.